I'm delighted to have you here. You are a leader in personalized medicine, and I would really appreciate it if we could just jump in and tell us why you practice personalized medicine. And if you could include some of the examples of why nature, nurture, and wholeness work often first, physiology before pharmacology, but
Ah,
in an integrative um, healthcare system.
yes. Well, thank you for the question. Actually, it's so very important. The people I see and serve, and this clinic serves, we really focus on complex, chronic, mysterious illness. So people have gone to see many health professionals and sometimes get passed around the circle, sometimes have experienced gaslighting, sometimes experience being invalidated,
Blaming the
and
victim.
absolutely. And not a good policy, as we both know, but unfortunately, as we see, it just happens too often. Or we see like, well, I can't explain this huge constellation of symptoms you're having, but I can check your cholesterol, and um, and so I think that's the concern is that so we focus on doing deep dives and starting all the way with how people were when their mom was pregnant with them and going and trying to put all the puzzle pieces out on the table to look for patterns and look for where puzzle pieces can connect. And a critical part of all this, from my experience, is listening at a very deep level for the meanings, the beliefs, and interpretations people bring to their experience, and also for how others have responded to it. And this is what's so very important, Bruce. You and I have both seen people who have re-experienced trauma in unfortunately in the medical system. And so we're part of personalized medicine here is, understanding one's narrative as presented, understanding one's use of language. So listening at the metaphors that people use often highlight ways of thinking about things in ways that people might not even be aware of. Um, and and then we key part is also to generate hypotheses that kind of may be underlying all these puzzle pieces, looking whether it's the Occam's razor idea or as I was in my education, I was told, Greg, if you make the right diagnosis for a person, great. But if you haven't thought about five other biologically plausible explanations for what they're experiencing, you're not really a good doctor for them. So I'm constantly challenging myself to think, what else, what else, what else? What are other windows to look through? What are other ways of kind of understanding someone's experience? And as you and I have both heard, don't get mad, get data. And so, what data would be most helpful
In
to?
regard to transgenerational influences and witnessing and letting go of trauma rather than re-experiencing the trauma or chemically suppressing the trauma.
Yes,
Have you crossed paths at all with Paul Brenner?
I have not. So I'm writing down
Yeah,
Paul's
Paul
name right.
Brenner helped Norm Shealy found the American Holistic Medical Association in the
Okay.
late 1970s. But
Uh-huh.
for some years now, he's been working at Scripps Clinic on cancer people
Mhm.
who have transgenerational issues. And when they're able to surface, observe, witness, let go of, and relax into an understanding rather than just re-experiencing the trauma,
Yes.
very
Yes.
often remissions happen.
Well, this is such an important topic about transgenerational. I think you and I both recognize that in the Hebrew Bible it talks about things being passed down onto third generation. We have seen epigenetic changes across generations. And so, in fact, actually, in some sense, we are our grandparents to some degree, and we carry their experience with us. And yes, and so how do we honor that? How do we acknowledge that? How do we work with that? Is our great challenge. And as you pointed out, it's kind of like the answer might not be found in a pharmaceutical suppression of things. And so,
So just to put some quantitative data to what you just said, epigenetics, lifestyle, habits of daily living are 92% of your lifetime health. Almost every major group that has looked at that has concluded 92% or more is habits of daily living. The other 8% is DNA, RNA, genetics, omics, and transgenerational influences. If you have the habits that you inherited from your grandparents, I can predict your future. If you change your habits, everything changes. And we have defined 4 self-assessments and 8 predictive biomarkers that cover all of lifestyle and epigenetics. And we think they should be interpreted to best outcome goal value rather than some statistical range.
makes total sense. So tell me about your greatest challenge in being able to convey this. I've struggled to try to get colleagues to even measure a vitamin D level, and we know how important that can be. And so, so as we think about maybe as the world is involved in this immense sense of change right now, maybe this is an opportunity to kind of really convey this. And so, what might be a good way that actually people listening to this right now might also be able to take this further and kind of promote this idea about low cost, low toxicity interventions that can make a big difference and empower people to be independent of the medical system?
Well, to include symptoms and the medical system within its narrow frame, but personalized, proactive, predictive, primary prevention practices and protocols are available. We do our best through the Health Studies Collegium and the PAH Academy certification program to spread the word and spread the message. And my experience has been that until someone gets seriously ill, they often give lip service, but they don't pay. Well, the coin of the realm in my world, and possibly yours, is time. How can I create meaningful moments? How can I be a better me tomorrow? How can I function at half my chronological age based on these predictive biomarkers? And we reviewed maybe 100,000 lab tests, but only 8 cover all of lifestyle and epigenetics. And then the piece we add, which I think is very consistent with how you practice, we want to look at the best outcome goal value and how someone compares with regard to hemoglobin A1C and how much sugar is stuck onto proteins, with regard to high sensitivity C-reactive protein and inflammation and repair deficit, in regard to plasma homocysteine, which turns out to be more important than your lipids, then your microbiome, your digestive tract, and how it delivers nutrients or harmful immunoreactive autoimmune problems. Then the vitamin D level, and it should be 50 to 80, not 10 to 20. And your omega-3 index should be balanced at about 8% or more. And then we add a urine test for DNA damage. Adeoxoguanine is a urine test, and those are enough to get started. Then you might want to investigate how your detoxification system is working. And you might want to make staples out of garlic, ginger, onions, red onions, brassica sprouts, broccoli sprouts, and duck or quail eggs. staples in your diet. Thomas Jefferson, the president, recommended them as staples, not as condiments. And
Huh, okay.
I'm a grieving optimist like President Jefferson, and I think he was a pretty wise gentleman.
Oh my goodness. Well, it's so interesting you mentioned about homocysteine, a wild story here. So in 2018, American College of Physicians, gathering of geeky internists like myself, 900 of us in a hotel ballroom to hear a world famous professor of neurology talk about dementia. 1 hour of presentation, and it was very nice. And I'm first up at the microphone to ask a question. And so I, of course, thanked him, etc. And I said, but you didn't really talk about nutrition metabolism. So I wonder if you could talk about throwing him a softball question. Thought about if you would talk about homocysteine. And we know it's a low cost test. We know high levels are strongly linked with all kinds of neurologic concerns, including dementia, and it's easily treated. And so could you please comment? His response was, huh, not aware of any data. Next question.
Kilmer
And
McCulley would be very disappointed because there actually is a lot of data of which he seems to be ignorant, but of which you were aware.
yeah, well, and there's a big long line behind me, so I wasn't going to be rude. But on that day in 2018, there were nearly 1,200 articles in PubMed linking homocysteine with dementia. And so that it shows that you can be a world famous professor in neurology with all kinds of huge amounts of research funding from pharmaceutical industry and miss the fundamentals. And oops, we've kind of created a system where that's just an example of among many things like you just identified that, hmm, why aren't we focusing on foundational fundamental things before pharmaceuticals? Escapes me. I
Well, personalized prevention, personalized medicine would want that. I think when people are given a choice between nature, nurture, and wholeness, something natural to start, and then we can measure improvement, hopefully. I think that's today's medicine or tomorrow's medicine today. And yes, you and I had the great good fortune that we were curious enough to go out and get additional training after our residencies at thousands of hours on symptom reactive care and which prescription to write.
Yep.
That's a piece. But when you ask a colleague today to talk about nature, nurture, and wholeness, to talk about nutrition and lifestyle, to talk about environment and relationships, they often look back at you like a deer in the headlights saying, I want to talk about this new third generation peptide, which might be interesting. But what about the upstream? What about the real causes, not just the symptomatic consequences? And that very often has to do with a saga, a tale. And deep listening is all too rare. But when a colleague or a client finds a physician like you who's willing to listen and maybe observe about a turn of a phrase or a so-called Freudian slip or a Jungian slip, how did you come to this? Because I admire the fact that you do. I think your patients are very fortunate. Yes, many of our colleagues basically have hardening of the categories, and their brains are not open like a parachute, they're closed. And I keep very quiet when colleagues are not receptive. But I can tell you that at the highest level of policy and practice today, Don Berwick, Elliot Fisher, many, many other people, like C. Norman Shealy, who pioneered, he was a neurosurgeon, a non-operating neurosurgeon from Mass General, who helped found the American Holistic Medical Association, which we today need more than ever. That holistic, integrative, comprehensive, personalized, and caring, competent approach to each individual. I don't take care of statistics, and I don't want to become a statistic. But I do want people to know that I care. And it takes more than 5 minutes. So part of the problem today is that the doctor doesn't really expect to ever see you again, and he only has 15 or 10 minutes to write a prescription, make some notes, and move you on.
Yeah, that's what they get rewarded for, and so people respond to rewards, and people avoid pain, and so yeah, so there needs to be kind of outlets for people, and there need to be kind of in some sense. The clinic in which I practice is kind of a safety valve for colleagues in town who say, "Gosh, I know there's something going on with Mrs. Jones, but I can't do it in 15 minutes. It's too complex." And so there's that kind of safety valve to prevent burnout among colleagues, but there's also a safety valve for patients who one patient recently described going to see a neurologist. They had a whole constellation of symptoms, and they were really told no one could possibly have this many symptoms. This isn't real. And how what and it's just kind of, it seems like it was more self-protective from the neurologist than really this idea of doing no harm. And so we know that to be heard is itself therapeutic. To have one's experience validated is also therapeutic. And then to be able to take that further and to generate hypotheses and an action plan for moving forward that shows promise at making sense of what has been going on, that too is therapeutic. And that can't be done in 15 minutes. Although I know I would love our colleagues to try harder, but I know that they're human and there's only so much we can do.
Well, very often they're in a system that dictates to them these
right.
restrictions. I was sitting on a plane next to an ophthalmic surgeon, and she was charming. And so I said, how long do you get with each patient? She said, 12 minutes. I said, who determined that? She said, my business manager. I said, do you pay the business manager, or does the business manager pay you? I said, if you employed a health coach or a physician's assistant or a nurse practitioner to amplify you, you might be able to spend a few more minutes and get to know your patients. And I'll bet their outcomes will be better when they have confidence in you because you care enough to listen. And she did. She fired the business manager.
Ah, okay. All right. Well, yes. I mean, there is this kind of also sense of attachment. And, the three forms of human suffering, the woulda, coulda, shouldas, the what ifs, and the comparison. And I think the comparison often gets also translated into what is my salary compared with others, and that just creates suffering, and it distracts one from the real reason why they went into healthcare and why about their role as a professional in the service of healing, and so we can step away from that somewhat, but I know that's kind of countercultural. But
Well, I think it was University of Minnesota that did a very interesting study. They took undergraduate students that would go into law, basic science, clinical work, and research. Those who went into the law became more mature. Those who went into basic science matured. The medical students significantly deteriorated in regard to their compassion, their ethical values, and their priorities just in the 4 years of medical school.
oh my goodness.
Oh, yes. This
Oh,
is
that's
a
scary.
this is
Wow.
this is something to be not forgotten. This is to be remembered and hopefully um, utilized to reform the medical education system.
Mm.
We could be teaching all the things that AMSA, the American Medical Student Association, in the 1970s articulated 18 topics that we urgently wanted to be incorporated into the curriculum. The AAMC is still considering this to this day.
Oh my goodness. Well, what's I've been termed an old AMSA type, an OAT. And I was active in AMSA in the mid 80s, and that's what kept me sane during medical school because there were colleagues there who were passionate about making a difference and being meaningfully helpful in the world.
Patch
And so,
Adams, do you remember Patch?
yes, yes, yes.
Patch studied acupuncture with Queen Nguyen Wu at the same time that I did. There was Jim
Huh.
Johnson. There were a number of us. It was only a few. It was a band of brothers mostly. But yes, we were convinced that the one thing we were sure of is we couldn't do worse than the current healthcare disease care system.
Well, so you've been an icebreaker then for quite some time, and um, and what gives you the most hope at this? We're about to
Oh,
enter
consumers.
2025. What's most hopeful for you at this time?
Consumers are waking up. They're asking about the quality of their food, of their beverages, of their relationships, of their environment. And I am convinced that when the consumers move in a certain direction, like towards health promotion, systems and doctors will get interested in being paid for that. At the moment, we are still suffering from what you might call the Descartesian mistake. This is from the Enlightenment period around the time when our country was founded. And basically, it says there might be a watchmaker, we're not sure, but the watchmaker has left. And now biology gets reduced to a mechanistic understanding. And we're gonna take the body apart, the cells apart, and we're gonna put it back together again. And we're going to be in charge.
And well, thank
Every
goodness,
part of that is wrong.
yes, the body is
Every
not a
part of that,
machine. Yeah,
yes. So I had the great good fortune, both in Boston and then at NIH, that my mentors and my bosses, they said, we don't know much of anything, do something. Anything you do, from occult blood testing for early colon cancer, or how collagen interacts with platelets and the importance of that for diabetes and cardiovascular disease. They said, just show up and do something. I
yeah,
didn't realize until recently what great good fortune it was, because most of the time residents are told what to do and they're programmed: watch one, teach one, do one. Oh, sorry. Watch one, do one, teach one, but that something like that.
yeah.
And
Reproducing the system and not really looking more broadly. So,
no, I think the system needs to be massively reformed, and we need to learn from these experiences how to improve healthful caring, not just symptom reactive care.
yep, yes, yes. Well, I love that expression,
So
symptom reactive
thank you.
care.
No,
Yeah,
thank you very much. We're about at the time
yes,
limit of these little
yes.
conversations, podcasts. But thank you so much for being who you are, for doing what you do, for being the safety valve that you are, and for being available to colleagues who want a second or a third opinion.
Well, thank you, Dr. J, and thank you for all your work. And it's a pleasure being here with you. Thank you.